Now to our regular segment, Matter of Health, and something that's very close to my heart this week. I'm sad to say, for the past week or so, I've been battling this slightly strange sore back, hip thing that I really can't quite identify, but I'm not alone. There are millions just in Australia who are suffering very similar ailments, and Brad McKay is here to tell us why. So good that I'm not alone, but not good that I've had a sore back.
No, there's about 50% of Australians have had a sore back over the past month. About 3.7 million Australians.
Month?
3.7 million Australians have a bad back right now, and we expect about 90% of Australians to have a bad back at some stage of their life. So, yep, you're certainly not alone.
Doesn't help though with the pain, I've got to tell you. But bad back, that covers a range of things. What are we talking about?
Yeah, well, one of the big things is that we often don't know what the cause of a bad back is. So sometimes we can put our finger on it and we can sort of like know if there's an infection or if there's a squashed nerve, or if there's something serious going on. But the vast majority of bad backs, we really sort of like don't see that pathology. Even if we're doing an X-ray or a CT scan or an MRI, we really don't sort of see that what's actually causing the pain. So we used to scan everybody, do lots of X-rays and not get much of a change in management. So a lot of doctors these days will sort of like just stand back and say, look, if there's no red flags, if we're not worried about anything particularly sinister, then we've got time up our sleeve, and we expect most people who have a bad back to get better over about a 6-week period. So the vast majority of people get better within a few days.
What do you mean, so get better? It just works its way out, or that whatever's happening just starts to heal itself, if you like?
Yeah, well, we spend about $4.8 billion on bad backs in Australia. It's a major industry, and the problem is that we don't have heaps of research showing exactly what works for which people. So a lot of people will see their chiropractor, their physio, their osteopath, they might have acupuncture, they might have heat therapy, all of these sort of things. But when we're actually looking at the research, we find that people will just get better anyway. So a lot of people will just get better from exercising, going for walks around the block, gradually getting back to their normal pre-morbid condition.
Oh, that's interesting you say continue to be active, because you know what you feel like sometimes is doing absolutely nothing, but you should maintain some activity.
Yeah, well, back in the 50s we advised people, okay, bed rest, you'll just be lying on your back for the next 3 weeks, don't do anything, put on a back brace to sort of hold yourself together. And we found that people just really didn't do very well. Just putting on the back brace made the muscles weak because they didn't have to act at all, and the muscles would wither over that period of time. So these days we're like, yep, get back into it straight as quickly as possible, keep on moving, and that's the best thing that you can do.
How do you know if it's muscular or structural? You know, the pain often won't necessarily be an indicator. You'll just feel as if you have a bad back. But how do you decide the difference there?
Yeah, one of the theories about what causes a lot of bad backs is that the bones can just move slightly out of position. There's a lot of muscle spasm that happens around those joint sites, and then it's like a big earthquake. You've got the epicenter where the problem is, and then all of the muscles just spasm, and then people often can't pinpoint exactly where that pain is from.
That's been the same thing with me. I've probably found that it's more towards the back of my hip. As it started to get better, I can sort of locate that. But at various times, it's been a pain in my side, on the other side, in the tailbone. It's felt like it's been everywhere.
You're my nightmare patient.
Maybe just falling apart. You know, that's my problem. But it does travel, which is very strange.
Yeah, and that's why we sort of can't often pinpoint where things are going. It can be like a wave of pain. Different people feel it in different ways. It also involves like whether you're stressed, like what's happening with work, how much sleep you're having, how much back pain you've had previously. There's all of these other factors that really come into our emotional feeling of pain as well as the physical aspects of pain.
And you mentioned before the risk that there may be something more seriously wrong, and I suppose if it's chronic, in my case it hasn't been, it's been just a nagging sort of sensation, but if the pain is chronic, or if there is inflammation, if you have a fever, what are the things you should look out for? This may be more than just your run-of-the-mill back pain.
Yeah, so the red flags that doctors look out for, one is getting a fever. So I've had some patients who get a very hot temperature and then they can't move their left leg. And then once the fever goes, then they're back again. So we get worried about sort of having an infection in your disc or around the nerve. nerves. If people are having like severe pain shooting all the way down their leg, then we're worried about sciatica and nerve compression. And some people get what's called a cauda equina lesion, where the bottom part of their spinal cord, where all the nerves come out, if you have a large disc prolapse at that point, it presses on the nerves, and then people often can't pee or poo. So these are all big things that we get worried about, and then we're sending off people to the hospital to get a scan pretty quickly.
And are things like the back related to other things as well, other potential illnesses? I know you mentioned there, you ran through the various other problems, but can you say, oh look, I've got a bad back, but actually it may be something very different in another part of the body?
Yeah, well, some people will have like a little bit of a bad back and maybe a sore neck, and some of those people will have like rheumatoid arthritis or ankylosing spondylitis, some of these inflammatory rheumatological conditions that can, like just be like anybody having a bad back, but if we don't treat it and if we're not seeing a rheumatologist for ongoing treatment, it can be quite progressive and then destroy joints. So it's sort of these little hints and things that doctors are looking for to make sure it's not too sinister.
But basically, suck it up. Wait to get over it. In my case, stop complaining.
Well, keep on moving. Don't ask your doctor for, or demand an X-ray from your doctor if we're not recommending it, because the majority of the time it will just get better by itself. But yeah, we're also needing a lot more research. We're needing to put a lot more money into back pain and find out what works for what people. Big black hole in that area at the moment.
I complained to my wife and she says, a man complaining about pain. I've given birth. That usually stops the conversation. Thanks, Brad. Good to see you.
Cheers.